Hi, I'm Janelle Marie. Welcome to Body Beautiful. This is the show where we talk with local professionals about the latest in cosmetic procedures and medical devices. With us today, we have plastic surgeon Dr. Joseph Mealy, and we're talking about a few different procedures today. First up, mommy makeovers, then breast lifts, breast reduction, and then finally chin implants. I don't think we've talked about those. All right, remember, before we get started, any advice we give you today, consult your own physician first. All right, Dr. Mealy, thank you for joining me once again.
It's nice to be here.
All right, let's just get right into it. Mommy makeovers, okay?
Okay.
You have a baby, you're a little, you think you're a little saggy, it's time for a mommy makeover. Who's a great candidate for that? Just mommies or who?
Yeah, well, yeah, otherwise daddies will be thinking I'm calling them names. But yes, mommy makeovers are best for mommies. The reason that came about is there's a combination of areas that get bigger and smaller with pregnancy, the breasts and the bellies in particular. Yeah. And sometimes as they get bigger, after the pregnancy, they shrink, and then the skin's a little bit loose. Yeah, yeah. So we're either doing something like adding volume back or lifting the breasts, and for the belly, just sort of tightening it, getting rid of the extra.
All right, so should women, what if they're breastfeeding? Should they wait until after everything is all done to start any kind of surgery?
Yeah, it's probably best to wait about a year.
Really?
It's kind of a random number. It comes about a lot from the weight reduction surgeries that we do. So after someone loses a lot of weight, we know the body takes about a year to fully recover and shrink as much as it can. And at that point, kind of what's left is what's going to be there. Someone who's in good shape, close to their ideal body weight is also very helpful. And someone has a good idea where they want to be.
Because sometimes women's, if they're breastfeeding, sometimes their breasts will deflate, sometimes they won't, right? So it's different for every individual, right?
No, last week I did a breast reduction on a lady whose breast grew a cup size with every pregnancy.
Oh, really? And stayed that way?
And stayed that way.
Oh, okay. Yeah. All right, real quick though, I want to talk about C-section scars. If a woman has a C-section, now when you go in to do the mommy makeover, is that C-section scar gone? How do you work with that?
It doesn't bother me either way, but it is gone.
Oh, good.
So when I do a tummy tuck, I want to keep the scar very low. So usually it's below the level of the C-section. Okay. And that skin above the scar is removed, so the previous scar is gone.
Good. So just one scar, no big, and low enough to, be hidden by underwear?
Low enough so it's below the belt line, bikini line.
Do you have to do all these procedures together? So breast lift, everything together?
No. Obviously, they can be done separately. If it's in the same region, sometimes there's advantages to doing them together. So breast and augmentation, I prefer to do them together. Some doctors prefer to separate them. Some doctors want to do a lift first and then come back and do the augmentation. I think it kind of helps me to do them together because they can work with each other and give us a better result. And
you don't always need an implant. We're going to go to pictures in just a second. And I just want to recovery
Implants
time.
are just for size. So if we want things bigger, then we need an implant.
Okay, so you don't really need an implant all the time.
No.
A lot of people
if someone's happy with the size and it's just that it's low, then we do a lift.
All right, good to know. Let's take a look at before and after picture. First, though, recovery time real quick. Let's say you do it all together. What's your recovery time?
It's a week or two.
It's not bad.
It's similar to just a tummy tuck.
Okay, not bad.
I think the breast augmentation adds a lot to the recovery. It is a little bit more inconvenient the first few days because the arms are sore too. So it's a little harder to get up, but beyond that, I think the recovery is the same.
Before and after photos. First one, let's take a look.
So you can see things got stretched out and dropped. So she's got still quite a good amount of breast tissue.
Yeah, that's not too bad.
And her belly's kind of pushed forward mostly because the guts are pushing on the muscle. The muscle's loose. It doesn't have a lot of fat out in front of that. So what I've done is remove that extra skin, tighten up the abdominal muscle. That's what makes the biggest difference on the belly. And the breast, we did a lift and sort of lifted everything up. So
do you always have to tighten the stomach muscles?
Almost always after pregnancy. I almost always do. For men, not as frequently. Because we don't have babies, but if we stretch out that muscle, it's worth tightening it up.
And it looks very natural. That's a very natural. And did you do an implant?
In this case, I think it's just a lift.
It looks
no implant.
So very nice. Next picture.
So here I've done kind of the same thing. We've tightened up the abdominal muscles. Everything's nice and straight and smooth. And then the breast has been lifted, and I think I did use a small implant in this case.
Small implant in that one?
Just to give the upper pole a little bit of fullness.
Now,
it's not always necessary, though.
When you do the tummy tuck, how long does that last? Do you have to go back and get another tummy tuck maybe as years progress? Does it last pretty much?
Not usually, unless someone gains a significant amount of weight and loses it or sometimes becomes pregnant again.
Okay.
So we usually wait till
you're done having the baby.
Before doing the tummy tuck.
All right, next picture. Wow.
So here everything kind of dropped. So in this case, I did a reduction, reduced the size of the breast, and then tightened everything up. And you can see, what was covered by the underwear before was a big extra roll of skin. That's called the pannus. So basically, did a paniculectomy, got rid of the pannus,
Oh, wow.
and then tightened up all the muscle underneath there too.
I was going to say that, paniculectomy.
Paniculectomy. You say that very well.
Thank you.
In this case, if she'd been a little closer to her ideal body weight,
Yeah.
there'd be less fat inside, and I could tighten things up a little bit more.
Gotcha.
But it's kind of like closing a suitcase. When there's a lot of stuff in there, you
Yes.
can't over-tighten
really-
it. It'll just cause trouble.
Next photo.
So similar. Again, I think this was the first one, wasn't it? We reduced the abdominal skin.
No, because
tightened
those are
everything up.
different underwear.
Those are different. And then we've done a lift to bring everything up.
All right, let me talk about stretch marks, because women go,
Yeah.
oh, I had babies, I got stretch marks. Can you get rid of the stretch marks when you take the skin off for a tummy tuck? Will those go away?
Yes and no. I mean, the skin that we're getting rid of that has stretch marks in it, those stretch marks leave. The
Oh,
stretch
good.
marks that are above it, though, will still be there.
Okay.
So there's nothing I can do to really erase stretch marks. I really wish I had something that would take care of that.
Those are a pain, aren't they?
They're a tear in the dermis. They're a tear in the deeper part of the skin. So, it's intrinsic in the skin. So unless we're removing that skin, it's still going to be there. However, the stretch marks that are above, if they're a little bit crepey and loose,
Yeah.
when we tighten the skin, they do tend to look better.
So what is it, just the person's skin that determines that? How, if you're going to have
It's
stretch marks or not?
It's a combination of stretching and I think estrogen contributes because they're much more likely in women, more likely
All
in
right.
adolescents, more likely with pregnancy.
Sounds good. For more information about Dr. Mealy, you can call 925-943-6353 or check him out on the web at either drmealy.com or sanfranciscobreast.com. Thank you, Mommy Makeovers. We're coming back with lots more, so stay tuned on Body Beautiful.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor.